Hi, this is Dr. A with your medical terminology video on the digestive system. We're going to look at signs and symptoms. All right, so let's start with anorexia is a loss of appetite. So an is no or loss and orexia is appetite. And this may accompany other conditions. It is different from anorexia nervosa, which is a condition on its own. And, so this is just anorexia just means you don't have any appetite. Aphasia is being unable to swallow or to eat. So you cannot put things through. Aphasia is eat. Ascites is a collection of fluid in the peritoneal cavity. It will make the abdominal cavity or just the abdomen look really large. Bradypepsia is having a slow digestive system. Cachexia is weight loss and generalized wasting that occurs during chronic disease, where you also have muscle wasting. Cholecystalgia is gallbladder pain. Constipation is difficult or infrequent defecation. Dentalgia is tooth pain. Diarrhea is the passing of frequent watery or bloody bowel movements. Dysorexia is an abnormal appetite, usually a diminished appetite. Dyspepsia is indigestion or having an upset stomach. And dysphagia is having difficulty swallowing or eating. Emesis is vomiting. And eructation is burping of gas or stomach acid into the mouth. It's belching. Flatulence is the presence of excess gas in the stomach or intestines. It's passing gas. Gastralgia is stomach pain. Hematemesis is vomiting blood. And hematochezia is passing of bright red stool in, where you can really see, you can see the blood in there. And this is going to be different from the last one here on the slide, which is melena, which is the passage of dark tarry stool due to digestive blood. So if the bleed, if there's a GI bleed, if it's further up in the GI tract, like maybe in the stomach, by the time the blood has made its way down through the GI tract, the bacteria and the enzymes have digested it, and it makes the stools, the poop look really dark and like tar, like almost black. But if the bleed is lower in the GI tract, so maybe in the rectum or anus, or somebody has hemorrhoids or something like that, then you will see hematochezia, which is the bright red blood in the stool. All right, hyperemesis is excessive vomiting, and jaundice is a yellow cast to the skin, mucous membranes, and white of the eyes. It is caused by the deposit of bile pigment. So this happens when the liver is not working properly, or the bile cannot flow out of the liver into the GI tract, and it gets backed up, and it'll back up into the bloodstream, and then once it reaches a certain threshold, you'll start seeing the yellow tint to the skin. And so it's important to really assess it in the white of the eyes, because regardless of skin tone, everybody's got white eyeballs, and that will show up there quite clearly if there's jaundice, whereas with the skin tone, it may be dependent on how light or dark your skin tone is. You may or may not be able to assess jaundice on the patient. Nausea is the urge to vomit. Obesity is having too much body fat that leads to a body weight that is above a healthy level. Polyphagia is excessive eating, and postprandial is after a meal. Pyrosis is pain and burning sensation, usually caused by stomach acid splashing into the esophagus. It is also known as heartburn. And regurgitation is the return of fluids and solids from the stomach into the mouth, which having to do with emesis, right? Regurgitation, things coming back up. So, all right, that wraps up our signs and symptoms of the digestive system.